Hello, Namaste everyone. Welcome to the another lecture. This lecture is based on the fourth principle of involved in the management of poisoning. So this principle is based on the poison elimination from our body. So in this particular topic, we are going to see how we can eliminate the poison from our body. So elimination basically tells us how we can remove the poison from our systemic circulation. As in decontamination, we were discussing about the removal of poisoning from the alimentary canal. That is, in the decontamination process, the poison will be removed. The poison will be removed before absorption. It is before absorption. It's not absorbed. Similarly, in elimination, after absorption, these poison substances will reach to the systemic circulation. They will reach to the systemic circulation. Once it will reach to the systemic circulation, then also we can take out the poison substances. That concept is known as elimination. Hope you understood the concept of elimination. So basically there are two different techniques from which we can remove the absorbed poison. First is the forced diuresis. So in the forced diuresis, what we will do means we will administer some diuretics to the patient. So what these diuretics will do means these diuretics will do to the go to the nephron of kidney. Then there they will work in the various channels, various pumps. From there they will enhance the excretion of sodium ion. When this sodium ion will be excreted along with them, water level also will be excreted. In that, along with these water and sodium ions, these poison substances which are diluted in our blood circulation, they will also go out of our body. So this concept is known as forced diuresis. Here high ceiling loop diuretics will be used. What will be used? High ceiling loop diuretics will be used. Some examples can be furosemide, torsemide. So these drugs are widely used to induce the forced diuresis. Then there is another very important technique that can be used to remove the absorbed portion from our systemic circulation. These techniques are known as extracorporeal technique. Extracorporeal techniques. So why we are telling them as an extracorporeal technique means extra means outside of our body. So we are using some sophisticated devices or tools which will help us in filtering our blood. What they will do? They will filter our blood. So these mechanisms are based on various principles. They are based on various principles. We are going to discuss these principles one by one. Now coming back to the topic, in this extracorporeal technique, the most commonly used and widely preferred technique is the hemodialysis. Hemo means blood, dialysis means to filter. Now here what we will do, this blood we will try to filter, right? Now I will try to explain this by this particular example. All of you please pay attention. Let's say this is one victim. So he is now intoxicated with the poison substances and poison is in the blood circulation. Now in the hemodialysis technique, what we will do, we will access to the blood supply of this particular person. Then we will develop one grafting in his body from where the blood will be taken out into the device. This device is, let's assume this device is the dialysis device. Now in this dialysis device, what will happen means the blood which will come from this particular device, right, this blood will go through some filter, as we have seen the filtration unit for the drinking water. Similarly, this filtration is there in this hemodialysis process also. In this what happened, basically there is one filter, we will say it as a filter. Now what is happening when we are taking this blood, let's say example, we are taking this blood from up to down. This blood we are taking from up to down. Then in this situation what is happening, in between there is one cartridge. Then blood is going around the cartridge and in between the cartridge. Right, this is a filter cartridge. Now the blood is going from outside also, then from inside also. However, this cartridge, there is a space. There is a space. In this space, we will pump the dialysate. So this dialysate is basically a sterile fluid containing electrolyte. Now, when this dialysate will go in one direction and blood will come from another direction, so the electrolyte which are less in the blood will get absorbed into the blood through this semi-permeable membrane. This outer layer of this cartridge is made from semi-permeable membrane. These electrolytes will come out from the semi-permeable membrane into the blood if it is less. If it is more, to maintain the equilibrium in the principle of diffusion, the electrolyte will go into the blood. As we have discussed in the last class, ki potassium, if potassium level is so much, hyperkalemia condition, in such condition also we will go for dialysis. So excess of potassium level will come to this dialysis. Now once this fluid will come, this fluid we will say it as a dialysate, right? So in this dialysis process, this dialysate does not contain any poison compound. However, this blood is having the toxins. Now, to maintain the equilibrium, toxins from this blood will diffuse into this dialysate. Then these toxins will be taken out in the output fluid. So in this way, our blood will be purified here. Then finally, we will collect all this blood, and this blood will send through some pressure monitoring pump will be there, whether it is in correct pressure or not. Then there are some vacuum and bubble trapping will be there. If there are chances of thrombus formation or some air trapping is there, these will catch this trap. Then the purified blood or the blood which is having the less concentration of toxin will be entered into the body of person, and this is a continuous cycle. It will continue for hours together, so that the higher concentration of drug will go into the dialysis machine. From there it will get diluted and the pure blood will come to the human body. So this is the principle of hemodialysis, right? So what is the name of this principle? This principle is nothing but the diffusion process. So here what is happening means, the higher concentration of toxin is going to the dialysis and the equilibrium of electrolyte is also occurring. So this is a hemodialysis, one of the most widely used technique in the clinical setting, and this is quite useful. Now we will see some of the example how this hemodialysis came, right? Some for exam point of view. However, the detailed notes in the hemodialysis, I will be sharing some important slide in the Telegram channel, so that you can refer all these processes in detail there. Now here it was first used in 1930, but it was not so famous. The important consideration is that all drugs are not dialyzable by using hemodialysis. So we should not think that all drugs can be purified by this particular method. This is applicable to some drug which are capable of passing through the semi-permeable membrane. However, there is always risk of thrombus and embolism. Nowadays we are having the updated devices which will be having the air trapping or bubble trapping sections. However, still there is a associated risk of thrombus and embolism formation. So this was all about the dialysis. Hope you understood about the dialysis. Then we are having the second concept. We are having the second concept, or we will say second technique, that is called hemoperfusion. Hemoperfusion. Now here, let me explain the concept of hemoperfusion. In hemoperfusion, what is happening means, similar cartridge will be there. Now this is one cartridge. Let's assume this is one cartridge. Then there is one hollow structure. Then for example, if I am sending blood from here, I am sending blood from here. This is outside chamber. This is the outside chamber and this is the inside chamber. I am sending blood from all the direction. Let's assume this is circular. Generally this is circular. Similarly, we are taking blood from the human body. This blood is passed through this cartridge. In this cartridge, there are certain materials which are known as adsorbent. What we are telling them? We are telling them as a adsorbent. Right? Now these adsorbents are having one special capacity. These adsorbents are having affinity towards some toxic materials. Like in activated charcoal, we have discussed how it is adsorbing the poison molecule. Similarly, these adsorbents which are packed in these columns, these adsorbents are having particular affinity toward the toxic compounds. Now due to that affinity, the toxic compounds from blood will pass through the semi-permeable membrane. They will pass through the semi-permeable membrane and they will get absorbed with the adsorbent. So these all toxin materials will be absorbed with this adsorbent, and the blood which is having less concentration of toxins now this continuously from here these poison materials keep on going to the adsorbent section in the cartridge. Now here what blood will reach into the terminal section will have less concentration of toxins. Now this blood which is having very less concentration of toxins will again return back to the human body, so that in the continuous process over an hours, so these toxins will get readily absorbed into the cartridge and the purified blood will be returned in the human. Hope you have understood this concept also. What is this concept? This concept is known as hemoperfusion. What is this concept? This concept is known as hemoperfusion. Then similarly we are having third technique. This third technique is known as peritoneal dialysis. So this peritoneal dialysis is something like hemodialysis. However, it is used in the early stage of chronic kidney disease. In the poisonous condition, this is less likely to be used. However, it can be useful. Now we will assume that this is a human body. Now this is abdominal cavity of human body. Okay. Now in this abdominal cavity, we all know that there is a peritoneal cavity, that is we are having all the organs here. So this will be surrounded by one layer called peritoneal layer. What is this layer? Peritoneal layer. Like lungs are covered by pleural layer, heart is covered by pericardial layer. Similarly, this abdominal cavity is covered by one layer, protective layer. This layer is known as peritoneal layer. Now here this peritoneal layer will work as a semi-permeable membrane. As in the dialysis process we are keeping one artificial semi-permeable membrane. In the peritoneal dialysis condition, this peritoneal layer will act as a semi-permeable membrane. Now this cavity is there. This cavity is known as peritoneal cavity. Peritoneal cavity means this is an empty cavity. So what we will do, we will add some dialysate from here. We will get access to the peritoneal cavity. So we will add some dialysate here in the peritoneal cavity. This dialysate will stay in the peritoneal cavity for certain period of time. Meantime, what will happen means this peritoneal layer is having high vascularity. Blood circulation is so high in this peritoneal layer. Now blood which is coming near to this peritoneal layer will have toxins in it in the poisoning cases. Now these toxins or this poisoning compound will diffuse from this peritoneal layer into the dialysate, because the dialysate is not having any toxins. Here concentration of toxin is less. However, here concentration of toxin is high. So to maintain the equilibrium, the toxin from blood circulation will come into the abdominal cavity. Then similarly, if there is requirement of some electrolyte, these electrolyte will go into the blood circulation as in the hemodialysis. But hemodialysis is a continuous process and it's very effective also. This is less effective, however it can be useful in certain conditions. Then after some time, let's say example for staying for 1 to 2 hours, or sometime even as quickly as 15 to 30 minutes also, when this dialysate is saturated or the equilibrium is existing in between the external and internal environment, then this dialysate will be drained out. Then fresh dialysate will be again infused into the peritoneal cavity, and continuously this cycle will be repeated. So this is called peritoneal cavity. However, there is a risk of infection, but we all know that toxicity conditions are very crucial condition. So what will happen means once the person's life will be survived, we can take care of infection in the session. However, we need to strictly maintain the sterility through these procedures. These are the invasive procedures, right? Now another important, clinically important method is the hemofiltration method. So by name only, I think we could understand that hemofiltration. Here what we are doing, in the same manner we are sending blood to the cartridge. Now here this principle is only differing, almost all the procedure is same. So here what is happening means our blood is going through the central area, where there is a hollow area to enter the blood. So this is a blood. Right? Now here what we are doing means we are applying little more pressure. What we are doing? We are applying little more pressure. So due to this pressure, the poison will diffuse into the cartridge. What is happening here in instead of natural diffusion process, here we are using the pressure mechanism, right? If we are using the pressure mechanism, then this method is known as hemofiltration method. This is only the difference between hemofiltration and dialysis. In dialysis, the exchange of toxins and electrolyte will occur by the mechanism which is known as diffusion, but here we are using the pressure mechanism. This happens in the hemofiltration. Now our another important technique is the hemodifiltration. So this name is only telling, like now this is the cartridge of hemodifiltration. So in hemodifiltration, what we will do means, as in hemofiltration, blood will go here only, but with the pressure only. So now you will say, what is the difference between the hemofiltration and hemodifiltration? Instead of that, hemodifiltration will have additional advantage. We will run dialysate from here also. Now, the exchange of these toxin materials will take place by two different mechanisms. One by pressure mechanism, another by diffusion mechanism as in hemodialysis. So basically, this hemodialysis is nothing but the combination of hemofiltration along with the hemodialysis. So in this way, there is the filtration of blood is occurring. Then the finally pure blood will be collected here and it will send back to the human body. Now, the more concentrated blood or the impure blood or the blood which is having the toxin or poison substances will come into this cartridge, into this device. From here, the blood which is having low concentration of toxin substances will return back to the body of human. In this way, this extracorporeal techniques help us in removing the toxin from our body. Now, another important technique is the plasmapheresis. So this is one of the highly sophisticated technique, seldomly available in the hospital setup. Very advanced care, tertiary and quaternary care hospital are having this facility. So in this method, what we are doing means, we are sending this blood. We are sending this blood to the one device. So what this device will do means, this device will isolate. What this will do, this device will isolate this cellular component of blood. What this will do, this machine will isolate the cellular component of blood like RBC, WBC and platelets. So these all blood cells will be isolated by this device and they will be taken out. Now this entire plasma, which plasma is having toxins. Now this plasma will go out. This plasma will go out. This machine will only retain the blood cells and some important other compounds. Then when these blood cells will be isolated, another way we will infuse the fresh frozen plasma. Fresh frozen plasma. Where we will infuse this plasma? We will infuse into this device only. Now this fresh frozen plasma, which does not have any toxin compounds, these formed cells or these blood cells will now dissolve into this fresh frozen plasma. Now this blood which we are getting is having almost no toxins or very less amount of toxins which are retained into these blood cells. So now this purified blood will send back to the human body, right? So this is how this plasmapheresis technique helps, right? So here what we have to understand is this plasmapheresis is the effective one, but very sophisticated and very costly also, and it is having poor availability also. So these are some consequences or limitations available with the plasmapheresis, right? So these are some techniques where we are using to remove the toxin compounds from our body. There are techniques which are used in the used as an extracorporeal technique. Here we will summarize all the extracorporeal techniques used by seeing their principle. Our first important technique is the hemodialysis. In this hemodialysis technique, the principle is diffusion. Our second technique is hemoperfusion. In hemoperfusion, what is our principle? our principle is adsorption. Our third technique is peritoneal dialysis. What is the technique involved? Same as hemodialysis like diffusion, but this is a continuous process. Okay, this we can do for holding, right? This is a holding process, this is a continuous process. Then our another important technique here is the hemofiltration. Hemofiltration means where you are using the pressure gradient. Then our fifth technique is hemodiafiltration. Diafiltration means we are using the principle of hemodialysis also, that is diffusion plus the pressure mechanism. We are using both the techniques. Then our last technique is the plasmapheresis. So this plasmapheresis technique will take the separation technique, which will separate the cellular compound from the plasma, and this cellular compound will be dissolved into fresh frozen plasma. So in this way we are going to understand the extracorporeal technique. Now these extracorporeal techniques are very important from exam point of view also. So we can exam point of view also we can expect some 5 marks question, sometime even 2 marks question, sometime even 10 marks question, and this principle will sometime may be there in the MCQ type of questions also. So again, last quick recap. In the poison elimination, what is the first concept of poison elimination? Forced diuresis, where we will use some drug to enhance the diuresis. Then there are certain extracorporeal techniques. In first, hemodialysis based on the diffusion. Second one is the hemoperfusion based on the adsorbance principle. Peritoneal dialysis again based on the diffusion technique. Then hemofiltration based on the pressure technique. Hemodiafiltration, mixture of hemofiltration and hemodialysis. And at last we are having the plasmapheresis. So this was a topic related to the elimination enhancement in the poisoning condition. So with this we are going to complete our today's class. All these notes will be available in the Telegram channel. So stay tuned to our Telegram channel also. So thank you for paying attention to the today's class. In tomorrow's class we are going to discuss about the new topic called antidote administration, which will cover the chapter 2 of general principle of our syllabus also. Thank you.